Hello everybody, this is Dr. Kukreja Kalani and today I'll be speaking about cervical cancer awareness, meaning what are the signs and symptoms, what are the investigations and what needs to be done so that to avoid the early spread so that we can diagnose the problem and get the treatment course as to prevent its metastasis and the prognosis remains good. So cervical cancer is the cancer of the cells in the cervix. Receiving regular gynecological exams, getting pap tests and practicing safe sex are the most important steps that you can take towards prevention of cervical cancer. So cervical cancer begins on the surface of the cervix. It happens when the cells on the cervix begin to change to precancerous cells. Not all precancerous cells will turn into cancer. So it all depends upon your immunity and the exposure to the HPV virus and various other factors which are linked to the immunity. Now, which are the types of cervical cancer? We have two main types, the squamous cell carcinoma and the adenocarcinoma. 80 to 90% of cervical cancers are squamous cells. Now, coming to the basically what are the symptoms and causes? The signs and symptoms of the stage first, that is the stage 1 of cervical cancer, includes watery or bloody vaginal discharge. This may be heavy and can have a foul odor. Vaginal bleeding after intercourse between menstrual periods or after menopause. Menstrual periods may be heavier and last longer than normal. If the cancer has spread to the nearby tissues or organs, symptoms may include difficult or painful urination, sometimes with blood in urine, diarrhea or pain or bleeding from the rectum when passing stools, fatigue, loss of weight and appetite, a general feeling of illness, dull backache or swelling in your legs, and also abdominal pain or the pelvic pain. Now, what are the causes of cervical cancer? Most cervical cancers are caused by the virus HPV, a sexually transmitted infection. HPV spreads through sexual contact, could be anal, oral or vaginal, and can lead to cancer. Most people will get HPV at some point in their lives and not realize it because their bodies fight the infection. However, if your body doesn't fight the infection, it can cause the cells of your cervix to change into the cancerous cells. So there are more than 100 kinds of HPV and about a dozen of them have been shown to lead to cancer. Early detection of these types of HPV is a key in preventing cervical cancer. So regular screenings are very essential to identify the cell changes before they turn into a cancerous variety. So the HPV vaccine can help prevent HPV infection by protecting you against the HPV that causes up to 90% of cervical cancers. So what is a cervical cancer pain like? So pain from the cervical cancer may not feel like much in the early stages of the disease, if you feel anything at all. As it spreads and it progresses to the nearby tissues or organs, you may experience pain in your lower abdomen during urinating. Some people may feel unwell or tired or lose their appetite. So what are the diagnoses and tests which have to be conducted? Cervical cancer develops very slowly over a period of years. So before turning into the cancer, the cells in your cervix go through a lot of changes. The normal cells in your cervix start to appear irregular or abnormal. These abnormal cells may go away and stay to same or turn into cancerous cells. So regular gynecological checkups and screening with pap test can detect most cases of cervical cancer. A pap test or a pap smear test that collects cells from your cervix and then they are examined for the signs of pre-cancer or their irregularities. So, if your pap smear comes back as abnormal, further testing is necessary. This could include an HPV test, which is a specific test that checks the cells of your cervix for HPV infection. Certain types of HPV infections are linked to cervical cancer. So later the same sample, the tissue can be sent for biopsy if they suspect any cancerous element out there. There are many techniques that can be used to obtain the tissue. So by curettage or by scraping. So if the biopsy confirms cancer, then the test will determine whether the disease has spread to the other part that we call as metastasis. These tests might include the liver kidney function test, the blood and urine test, X-ray of your bladder, bowels, abdominal cavity. This process is called as staging. So basically these are the basic investigations and the signs and symptoms that we should be looking for in case of any doubt or suspicion of any changes depending upon the symptoms you experience. Now, the screening for cervical cancer, the goal of cervical cancer screening is to detect cell changes in your cervix before they become cancerous. So the Pap test, as we described earlier, the HPV test, these are the two main tests which need to be conducted. So what are the stages of cervical cancer? There are four main stages. Stage 1 is when the cancer is found only in the cervix and it hasn't spread at all. Stage 2, cancer has spread beyond your cervix and uterus but not to the pelvic cavity and the pelvic wall or your vagina. Stage 3, the cancer has spread to the lower part of the vagina and it also has spread to the pelvic wall and the nearby lymph nodes. And stage 4 is basically when it has spread to the bladder, rectum and the bones or the lungs. So these are the 4 stages of cancer. So basically the main aim of talking about this topic is to create an awareness about this subject so that you are aware about the signs and symptoms, as there are not much signs and symptoms. So the regular checkups are very essential in females, especially whenever you sense any irregularity in bleeding or any malaise and lethargy or excessive bleeding or discharge between the periods. So it's essential to get a Pap smear done, and vaccination schedule is also important. So hope I have briefed you up regarding the signs and symptoms, the investigations and the types, and the prevention. Basically immunity is also very, very important. So your general health has to be good and your parameters need to be in proper range. So regular checkups of women, the gynecological checkups, especially the Pap smear, the HPV screening, everything is very essential so that we can detect the problem earlier and we can treat it so that it doesn't spread to other parts of the body. Signing off, this is Dr. Kukreja Kalani. Thank you.